Wednesday, so it's time for us to smile as best we can because it's time for great smiles. Dr. Steffany Mohan is here from Plaza Dental Group. Talk about how to make you look good, Jackie, by making you smile better.
But we're also bringing awareness to a very special time of the month.
Right.
That has to do with oral care.
A very special time of the month.
Time to think about it, kids.
Right. It's Oral Cancer Awareness Month. So
now this has really gained some more notoriety in the past, I'd say 15 years or so.
I think so too.
Yeah,
I think so too.
And mainly because of how many younger kids decided that chewing tobacco is a good idea.
It's bad. It's bad. You know, it's also, I mean, young people, that's always a bad thing. You know, we try and raise them right and teach them good habits and all that. But the other thing that's really interesting is that oral cancer is actually connected to HPV. And so it has, I mean, a major connection to it. So, you know, hopefully as we get, you know, more Gardasil and that kind of thing into younger people, we'll see a decrease of oral cancer later on. But it's very, oral cancer actually has more people will get oral cancer than cervical cancer. It's actually a pretty major cancer, so it's not really, you don't hear a lot about it.
Now, when you mentioned oral cancer, is it just one in particular, or is it just a whole collection of different types of cancers?
Oral and oropharyngeal cancer, so like in the mouth and then kind of going back towards the you know,
throat.
Yeah, the gullet, right?
Okay.
So yeah, the throat or the going down.
Now, Jason, is this what Eddie Van Halen had?
Well, he never really talks about it, but I mean, there was some suggestion that he may have
That's
had
what it
that
was?
Right.
Yeah.
Okay.
Well, and the sad thing about oral cancers is that I mean, it can be very disfiguring. Obviously, I mean, if somebody has, you know, a cancer and it needs to be removed, sometimes it's part of the face that gets removed as well.
Now, is that what Roger Ebert was suffering from?
He had laryngeal cancer or throat cancer. So
pharyngeal.
Pharyngeal cancer. Yeah. So anyway, it's sad because but the great thing is that your dentist is looking for it, and we're really the only people that look in the mouth very consistently, right? And so it's funny because a lot of people think we're only looking at the teeth, and we're, you know, a lot of times if you ever get to the dentist and they pull out your tongue and they look on the different sides of it, that's an oral cancer exam. We're looking for the tongue. The base of the tongue is actually one of the major places that people get oral cancer.
What are you looking for?
So spots, red and white patches, looking for anything that's just unusual. I mean, you know, normal is normal and abnormal is anything that isn't. So a lot of times cancer, there'll be lumps or bumps or spots, and so we're feeling and looking. Yeah.
So another good excuse to go regular to your dentist.
It really is. I mean, can you have too much screening? You know, can you have too much prevention? Of course not. I mean, it's very, very good. I mean, a lot of people skip those. I mean, my husband is a physician, you know, and he skips his not his dental checkups by no way. Not going to happen at our house. But he does sometimes skip his you know, yearly physicals because he feels fine. Well, you know what? When you feel fine is the time you should go. I mean, when you don't have a problem, when your teeth don't hurt, when you know that nothing is, you know, apparent, because when things get too far down the road, that's when they start hurting. That's when they start becoming apparent. If you can diagnose yourself, you've gone way too far. That's
right.
Way too long to wait. So
now, if this is caught early enough, obviously it can be treated.
It's super treatable if it's caught early. If it's not caught early, then that's when it can be disfiguring. So it's the same thing. It's the same thing as cervical cancer. It's the same thing as pretty much any cancer, breast cancer. If it's caught early, it's very treatable. It's extremely curable. If it's not caught early, then that's when we tend to have a lot of trouble.
Now, when people are going to their dentist, is this something they should ask for when they're getting their checkup? Say, hey, can you just make sure that
They should ask for it. They should get it as a matter of course. I mean, it's very. I mean, one of the great things about the way that the system is set up in the U.S. with you usually see your hygienist for, you know, every 6-month checkups, and then the doctor comes in and does a check. When the doctor comes in and does a check, they'll do. I mean, the hygienist is also trained to do an oral cancer exam too. So the hygienist is going to be in there longer usually for general checkups, but the dentist is going to do the same thing as well. And again, I say this all the time, but dentists in Iowa are phenomenal. They get wonderful training. Most of us went to the University of Iowa, which, you know, is because it's, well, frankly, it's more economical than going to an out-of-state school. We have common sense in Iowa, right? And so the dentists are trained to do this, and most people do this as a very automatic matter, of course.
Right.
On the checklist. checklist.
On the checklist, it is. It's on the checklist. So we like the teeth, of course, but we also, you know, we make sure that those are. And statistically, most dentists will find at least a couple of oral cancers in their careers. So it's pretty. Yeah.
And being able to treat them, or is it usually beyond?
Usually it would go to, you know, I mean, a lot of times it would even go to the University of Iowa or go someplace else. But yeah, sure.
So you know where to send them in case
we know where to send them. Absolutely. Yeah.
All right.
Yeah.
So some good tips there.
Yeah, something to think about. It is a month dedicated to being aware of that, but something you need to think about.
Well, and I hate to scare people. I mean, I don't like that. You know, we don't do it to do that, but because, you know, but if we do find something early, then it can be treated very easily.
Well, it's good to be aware because, like you said, that's
to be aware.
One of the cancers like you never hear about. There's so many that we do hear about almost on a daily basis.
I know. I need a ribbon of some sort of color.
You need a color.
I don't even know what the color. I'm sorry, I don't know what the color is.
A tooth-colored ribbon, okay?
Right.
An ivory ribbon. There
It
you
could
go.
be ivory.
There you go. Well, good.
Yeah.
People want to get in touch with you or stop by your practice. Where can they go?
They can go to dmsmiles.com. Most people find us online. More and more, they find us online. But then they can also go to, they can call us at 612-7148.
There you go. Yeah. Perfect. Well done.
Thank
Good job
you.
as usual.
Thank you.
Thank you so much. It is 19 minutes past 9 o'clock. We'll